Distinguished members of the UN Group of Friends to Eliminate Hepatitis, esteemed colleagues and partners, ladies and gentlemen, good afternoon. And it has been a long day, John. But it is a true honor to be back here, John, and thank you for bringing us together to discuss one of the critical health issues of our time. But let me begin with a story of Eric, a 37-year-old from Manila, Philippines. In 2009, during a routine medical exam, Eric discovered he had hepatitis B. Overnight, his dream of working overseas vanished. For nearly a decade, he lived in silence, without treatment and under the weight of stigma. In 2018, he began therapy, but it was inconsistent. When he could afford medicine, he took it. When he couldn't, he went without it. In 2022, Eric was diagnosed with liver cancer. And 2 years later, he underwent surgery. His journey has been marked by pain, exclusion, and uncertainty. But with the support of the community group and access to affordable treatment, Eric found hope again. Today, he continues his care and dreams of a future free from stigma and disease. I think Eric's story is not an exception. It is a reflection of millions. Globally, hepatitis affects, as you heard, over 250 million people. In the Western Pacific region alone, more than 100 million live. More than 100 million live with hepatitis B or C, accounting for 1/3 of the global burden and nearly half of hepatitis-related death. This is not a health crisis. It is the crisis of equity, dignity, and human rights. But we have made progress. Thanks to vaccination, hepatitis B prevalence among children in our region has dropped by 92% since 2000, a public health triumph. But gaps remain. Only 26% of people with hepatitis B and 45% with hepatitis C know their status. Treatment coverage is still far too low. Without expanding testing and care, especially through primary health care systems, millions remain vulnerable to liver disease and cancer. This is where diplomacy and cooperation become powerful tools. In the Western Pacific, we've established the Regional Validation Advisory Group to support countries in advancing hepatitis elimination. And we are seeing momentum. Hong Kong, China is moving toward validation of eliminating mother-to-child transmission. Mongolia is expanding access through national insurance. Niue is preparing for hepatitis B elimination validation. These milestones show us what's possible when evidence, solidarity, and commitment come together. Yet challenges persist. Declining external funding, fragile supply chains, and deep-rooted inequities driven by stigma and lack of decentralized care. That is why this UN Group of Friends is so vital. Because health is and always has been a political choice. But today's theme, health diplomacy and international cooperation for the global fight against hepatitis remind us that change begins with collective will. And I'm proud to highlight the group of friends' successful efforts to include hepatitis elimination in the fourth and the final draft of the political declaration on NCDs, scheduled for a vote on the 25th of September. This marks a major step forward in global recognition of hepatitis as a driver of liver cancer and other liver diseases. The declaration calls for scaling up hepatitis B and C prevention, diagnosis, and treatment, hepatitis B vaccination, early detection of liver cancer, and strengthen screening and management for non-alcoholic liver disease. As a former commissioner of the WHO Independent High-Level Commission on NCDs, I believe this contribution is especially meaningful and a testament to the power of coordinated advocacy. Looking ahead, I propose that the UN Group of Friends consider initiating the process for a UN high-level resolution on hepatitis elimination. Raising this possibility now will advance our internal discussion and lay the foundation for a resolution to be reviewed and adopted in 2027 or 2028. Such a resolution would reflect the global burden of hepatitis and reinforce our commitment to the 2030 elimination goals, especially as the UN Sustainable Development Goals come under review in 2028. As we look toward a UN high-level meeting on hepatitis in 2027, our call to action is very clear. Expand diagnosis and treatment. Strengthen governance and partnership. Ensure affordable access to medicine and diagnostics for all, starting at the primary care level. And above all, center our efforts on people like Eric, so no one is left behind. And I want to remind you what Eric said. If you get hepatitis B, stay on treatment so you don't end up like me. That is why testing and access to medicine are so important. His words are a powerful reminder that elimination is not just a goal, it's a promise of life, of dignity, and hope. Let me close with a quote by Martin Luther King Jr. that captures our shared mission. Injustice anywhere is a threat to justice everywhere. Let us act, not just for Eric, but for every voice still unheard. Together, we can end hepatitis by 2030. And I thank you.
Thank you.